So, Doctor, tell us what this means, these numbers that we're seeing, so many deaths in the U.S. How significant is this?
Well, many of these deaths were really preventable because it's now also the 1 year anniversary in a few days of the availability of this vaccine, which the vaccines really became available in miraculously short time because people have been working on them for so long, and there's finally an opportunity to produce a vaccine that could save lives. But since the last 6 months, let's say, when most people could get them, this really would have been preventable. Most of those deaths in the last 6 months really could have been prevented. But unfortunately, in this country, although we have enough vaccine, there are many people who, for one reason or another, refuse to take it. And they're, as you said, largely the ones who end up in the hospitals. There are some illnesses among vaccinated people, but they're usually very mild. That's with the Omicron variant now, and very rare, and virtually no deaths, a very small number. So vaccination clearly is the right thing to do for people, and it's been puzzling to all of us why many people in the country will not do it and will take the chance of this death that we're seeing.
As an epidemiologist, I'm sure you're interested too in what the WHO just announced, that during the coronavirus pandemic, about 500 million people worldwide were forced into extreme poverty because of health care costs. I mean, that's a concern in the U.S. as well.
Oh, yes. For the coronavirus, for COVID, the government and the health insurers have covered many of those costs, but for almost all other health emergencies, and even for those related to COVID, there are many people who are not covered by health insurance, and it's often a cause, in this case, in the United States, of bankruptcies. Many of the bankruptcies before COVID were due to medical costs. And I think that that's really something that could be done, obviously, to provide more comprehensive medical insurance and medical coverage. But the other thing is that in the United States, we've kind of taken for granted the availability of these vaccines and treatments, although it's not available to everyone. Anyone who wants a vaccine can get one at no charge. And yet, in most of the world, it's not possible to have these treatments or these vaccines. And so they're waiting for it, while many people here are simply refusing to take the precautions.
Of course.
A real irony.
Yeah, agreed. And each day we see some countries put on more restrictions, but then we hear concerns from, say, the WHO that there sometimes is an overreaction. They're concerned about the effect that that has on poorer countries. But we were talking about this earlier, and our producer raised a good point that even if Omicron is not going to cause the number of deaths that we saw in the prior waves, even if only 5% of these new cases of Omicron end up with people going to the hospital, that could still overwhelm numerous health systems around the world, right?
Oh, yes. And, even in places that have relatively high capacity and well-resourced, the healthcare workers who've been dealing with this for, well over a year now are exhausted. So, it's very discouraging to them even if they're available to see these cases coming in. And Omicron is maybe milder. We don't know yet than some of the others we've seen. But yes, there will be illnesses, and in some cases, they will overwhelm an already overstretched healthcare system in all countries. And we're seeing that happening now. So we really shouldn't get complacent. We have the tools, vaccines, and the other precautions. And it's important not to get complacent because we've seen these spikes come every time we do.
Yeah,
and I think we just
Oh, go ahead.
Please.
Go ahead, doctor. Continue.
No,
Sorry.
I think we just have to do everything we can to continue vigilance,
Right.
because we just get complacent much too soon as the cases go down.
Yeah, I don't think everybody realizes either how few cases it takes relatively to overwhelm these healthcare systems. But thank you so much for your insight. Good to talk to you.
Thank you. It's good to be with you.